Okay, so think about this. Globally, someone dies from heart disease roughly every 33 seconds. That's huge.
It really is. And often the first thing that comes to mind is, surgery, bypass, stents.
Right, the big interventions. But what if there's another way? A significant option that doesn't involve an operation.
Exactly. That's what we're diving into today. It's called Enhanced External Counterpulsation Therapy, EECP for short.
EECP. And we're drawing on insights from two key figures here, Dr. Sukhbindar Singh Sibia in India
At the Sibia Medical Center in Ludhiana.
and Dr. Rakesh Mohanlall down in South Africa. He founded the Heart and Health Center in Durban and also the International ECP Association.
Yeah, and their work, you can even see it in their podcast titles, like Healing Hearts Beyond Borders and Healing Without Surgery. They're really pushing this shared mission.
A gentler way to heal hearts, basically. So look, if the idea of heart surgery makes you nervous, or maybe you're dealing with chest pain, feeling breathless, tired,
Or perhaps you've even been told, there are no more options left for you.
then this deep dive into ECP, well, it's definitely for you. We want to explore what this could mean.
And what's really compelling is how these two doctors, Dr. Sibia and Dr. Mohanlall, connected over this shared vision. It's more than just professional. It feels like a real mission.
A mission to offer alternatives, right?
Sure.
Beyond the standard surgical route.
Precisely. And Dr. Mohanlall, starting the International ECP Association, really underlines that, trying to build this global effort for non-surgical answers.
It's pretty amazing. One in Ludhiana, India, the other in Durban, South Africa, but both championing the same therapy.
Absolutely. And their motivations are quite personal, too. Dr. Sibia talks about seeing the real fear patients have about surgery and then witnessing these, almost miraculous turnarounds with EECP.
And Dr. Mohanlall.
He really emphasizes that heart disease, well, it doesn't care about borders. It's everywhere. And so we desperately need non-surgical solutions that can reach more people.
Yeah, and they keep coming back to that harsh reality, that 33-second statistic. It just hammers home the urgency, doesn't it?
It really does. And they make a crucial point. Surgery, while often life-saving, let's be clear,
Of course.
it often manages the problem rather than being a complete cure. It's more like management.
That's an important distinction. And what worries me, and clearly worries them, is that maybe you, listening right now, might not even know about options like EECP.
Right. Or even some doctors might not be fully aware or perhaps don't suggest it readily.
Especially when surgery isn't ideal, maybe for someone older or diabetic or just plain terrified of the operating room.
Exactly. It makes you question, are people getting the full picture of what's available?
So let's get into it. What exactly is EECP? The name sounds a bit technical.
It does, but the concept, as Dr. Sibia puts it, is quite elegant. He calls it a natural bypass.
A natural bypass. Okay.
Yeah.
Intriguing.
Yeah, it's non-invasive, remember, no surgery. It's designed purely to boost blood flow back to your heart muscle.
So how does it work practically?
Well, you basically just lie down on a treatment table, relax, and cuffs wrapped around your legs inflate and deflate in time with your heartbeat. This helps push more blood towards the heart between beats. Simple idea, really.
So you're just lying there, relaxing while this happens?
Pretty much. And the potential impact is significant. But it's not just about the heart, which is fascinating.
Oh, what else?
They talk about this whole body revival. They see improvements in kidney function, better blood flow to the brain,
Wow.
even relief from leg pain, like poor circulation issues.
So it affects the whole system.
Yeah.
And how long does this typically take?
The standard course is usually around 35 sessions, typically an hour each day for several weeks. So it's a commitment, but aimed at lasting improvement.
Right, not just a quick fix. And crucially, this isn't some fringe idea, is it?
Not at all. They are very clear on this. EECP is backed by solid science. It's FDA approved in the U.S.
Okay.
It's supported by numerous clinical studies, and it's accepted globally by medical bodies.
So the science is there. The approvals are there. Which brings us back to that big question.
Why isn't it more widely known?
Yeah. Why aren't more patients hearing about this? It seems like a disconnect somewhere.
It does. And this lack of awareness, it really impacts who could potentially benefit.
So who are they saying should be thinking about this?
Well, they mentioned several groups. If you've been told you need a bypass or angioplasty,
Okay, that's a big one.
definitely. Or if you're older, maybe managing diabetes or just have that real fear of surgery we talked about.
Makes sense.
But what's also really encouraging is that it's not just for people before surgery. They see benefits for those who already had stents or bypass.
How so?
It can help reduce angina, that chest pain, and maybe even put off the need for more surgery down the line.
Interesting. So it can help even after interventions.
Yes. And they even say it's generally safe for patients with kidney problems or those with lots of blockages where surgery might be even riskier.
So it really broadens the scope of who might be a candidate. It makes you wonder, if you're facing these issues, could this be a path for you?
Absolutely. And to make that point really hit home, they share some incredibly powerful stories, real people.
Like what? Give us an example.
Okay, there was this 58-year-old man in South Africa. He was scheduled for bypass surgery, did the EECP course instead, walked out pain-free, avoided the surgery altogether.
Wow. That's life-changing.
Totally. Or the 72-year-old grandmother in Amritsar, India. Surgery wasn't even an option for her. Doctors said no.
So she was stuck.
Seemingly. But after EECP, she regained the strength to walk to the Golden Temple by herself, something she hadn't been able to do.
Oh, that's wonderful. That gives you goosebumps.
It really does. And another one, a police officer in Durban, diagnosed with multiple blockages. EECP got him back on active duty.
These aren't just anecdotes. These are stories of, well, like Dr. Sibia says, miracles in motion.
Exactly. Or rebirth, redemption, as Dr. Mohanlall puts it. It really shows the potential impact on quality of life.
Which leads perfectly into their call to action, really. It's about awareness.
Yes. They're speaking directly to you, the listener. If you have that chest pain, the breathlessness, the fatigue, don't ignore it. Get checked out.
Please don't wait for a heart attack.
Absolutely not. And their core message is so direct. You might not need surgery. You might not even need more pills. What you need is awareness. You need to know about EECP.
It's a strong message.
And they back it up. They invite you, urge you, to call their centers before you agree to surgery.
Just to explore the option.
Yes. They promise an honest evaluation. Will EECP actually help your specific situation? They want you to have all the facts.
That seems very fair. And they make it easy to get in touch, right?
Super easy. For Dr. Sibia in Ludhiana, India, the number is +91, and the website is sibiamedicalcenter.com.
Okay, got it. And for Dr. Mohanlall in Durban?
That's +27, and the website is heartecp.com.
Simple enough.
And even simpler, they suggest just sending a WhatsApp message with the single word heart to those numbers.
Okay, that's clever. Low barrier to just starting the conversation.
Exactly. Plus, they're on YouTube, Facebook, and there's the International ECP Association website, too, for more general info.
So lots of ways to find out more. And they also had a message for doctors, didn't they?
They did. A direct appeal, really, asking their colleagues in medicine to just consider EECP. Think about it before immediately sending a patient for surgery.
Kind of a pause and consider message.
Yeah. And they even offer training and collaboration. They want to help spread the knowledge within the medical community itself.
Which is key to making it more accessible for everyone, for you.
Absolutely. It's about integrating it more into standard heart care.
So wrapping this up, the main thing for you to take away is that EECP, well, it's real, it's non-invasive, it's backed by science.
And it could be a genuine alternative to surgery for a lot of people dealing with heart issues.
It really boils down to hope, doesn't it?
Yeah.
And knowledge. A potential second chance for your heart, maybe without the scalpel.
Exactly. And that brings us to a final thought, something for you to maybe chew on after listening. In our world, we often look for the biggest, most complex solution, right? Especially in medicine. The high-tech, invasive stuff often gets the spotlight.
Sure.
But what if, just what if, a really effective answer for a healthier heart isn't always the most invasive one? What if just understanding all your options, including something like ECP, could literally change your life? Or the life of someone you care about?
That's a powerful question to leave people with. It really underscores the importance of being informed.
Definitely. So we really encourage you, check out those resources we mentioned. Take that first step. Awareness is key.